Hi everybody, welcome back to another episode on the Wellness Show. If this is your first time of joining me on the show, it is a weekly podcast where we discuss about health and wellness, and most especially we focus the conversation on information that you take for granted that is pertaining to your health and your well-being. I remain your host, Shobola Sarah Bolaji.
September is World Sickle Cell, and in the process of us making awareness, I have joining me on the show today is Nosalam on the show, and she would enlighten us about everything about sickle cell types, the definition, the complications. So you just have to follow as we dive into the interview. Hi Nosalam, how are you doing?
Hi everyone, my name is Nosalamo Monserrat. Yeah, I'll be enlightening us on sickle cell diseases.
Okay.
And a lot to be today about sickle cell.
Yes, and it's something very important that we need to create awareness. We need to say it to everybody and let them know that sickle cell is not a death sentence.
Of course, it's not.
Okay, so in your own term, or as a medical practitioner, what would you say it is sickle cell? I need you to break it down for people because you don't have to use the big grammar for people listening. So in a layman language.
Okay, sickle cell, in my own word, like in a very simple term, is an inherited red blood cell disorder. There aren't enough healthy red blood cells to carry oxygen throughout the body. But as a nurse, I would say sickle cell disorder is an autosomal recessive disorder that is characterized by chronic hemolytic anemia and painful vaso-occlusive crisis. So that's the simple definition of sickle cell anemia.
So in what way would somebody get to that aspect of giving birth to a child with sickle cell? Like, what are the causes of sickle cell disease?
Okay, and what usually results in sickle cell is when both parents have the trait of coupled hemoglobin in them. Like, let's take for example for AS and AS parents. If they eventually get married, they will surely have child that is carrying the S hemoglobin that is donated by both parents. So definitely the child will come out with the sickle cell.
Okay, you're correct. That's the genotype compatibility in the aspect of the crossing and also.
Yes.
Okay, thank you.
That's the main cause of sickle cell. Yeah.
So what are now the types of sickle cell that we have? I think we have various types of sickle cell disease, and I will just need you to make sure.
Yeah. Okay. Types of sickle cell anemia.
Okay.
The first one is the hemoglobin SS disease. So the hemoglobin SS disease is the most common and it is the most severe type of sickle cell. This one occurs when the child inherits sickled hemoglobin from both parents, like from the father and the mother. So the child definitely have just hemoglobin S in the body system. That's why we have SS. Then the second classification is the hemoglobin SBO, the beta zero thalassemia. The hemoglobin SBO, that's the beta zero thalassemia, it occurs when the child inherits the hemoglobin beta S, the beta S gene from one parent and the beta O gene from another parent. So that makes the combination of the hemoglobin SBO. Is the child inheriting hemoglobin S from one parent, like maybe the mother, then inheriting the BO thalassemia from the father. So S plus BO, it makes hemoglobin SBO thalassemia for the child. So that one is similar to sickle cell, that's the SS. They usually have similar signs and symptoms. Most of the time, they have similar pain, crisis, and all. Then the other classification is hemoglobin SC disease.
SC.
This hemoglobin SC.
Okay.
So the child inherit the hemoglobin S from mother or the father, and inherits the hemoglobin C from either the mother or the father. So making hemoglobin SC. So you notice that some people have genotype SC.
Yes, but it's very rare.
So it's very rare. This one is still a bit better than the SS because the symptoms in SC are less severe compared to SS.
Really? Okay.
Yes.
Okay.
So that's the third classification. Then the fourth classification is the SB plus beta thalassemia. That's the fourth classification. In SB plus thalassemia, some normal hemoglobin is produced but in reduced amounts. In SB plus, the child inherits S from either the father or the mother, and the inherits B plus thalassemia from either the father or the mother. So in this one, this hemoglobin SB plus is still produced like normal hemoglobin but in reduced quantity. Okay, you understand?
Yeah.
So the symptoms are less severe because of the normal hemoglobin. Their pain complications are not as much as SS or SA, but they also have their own complications too. Then the final one is the hemoglobin SD, the SD and others. You have the hemoglobin SE, hemoglobin SO, and so on. But this SD, SE, SO, they are less common and they are less severe compared to the SS and SBO.
Okay, so these
are the classification of the
types of sickle cell disease. So can you just run through it again? We have SBO, we have SC.
We have the hemoglobin SS disease, we have the hemoglobin SBO, we have the hemoglobin SC disease, we have the hemoglobin SB plus beta thalassemia, and we have the hemoglobin SD, SE, and hemoglobin SO. So which are less severe and less common. So that's just.
Thank you so much for that. What does sickle cell trait mean?
Okay, sickle cell trait simply means that people who have only inherited a mutated gene of hemoglobin S. Most especially, yes, it simply means that you have inherited a mutated gene of hemoglobin S from one of the parents. You understand?
Yeah.
Okay, let's take for example the AA and let's say husband is AA and the wife is AS and they get married. You know you have 25% chance of having AS.
Yes.
Abi?
Yes.
You have 75% chance of having AS.
Yes,
and you have 75%
of
having
AA. Yes.
So 25% chance of AS. It simply means that child has a sickle cell trait. It doesn't mean that the child is sickle cell. Yeah, she has sickle cell anemia. No.
Yeah.
It just means that she has sickle cell traits in her. That's the sickled hemoglobin that is in her. She has the normal A hemoglobin and she has the abnormal or the defective S hemoglobin. That's what it simply means.
Okay. We know most time the warriors, let me just call them warriors, or those that have sickle cell, most time they fall whenever they are sick. It's either it's malaria that is causing the crisis or it's stress, but most time it's always malaria. So the question now is that what is the relationship between sickle cell and malaria?
Okay, for malaria and sickle cell, in a normal human being, our red blood cells takes about 120 days before for a whole cycle, 120 days. But in sickle cell patients, their normal red blood cells take just about 10 to 20 days.
Yeah, correct.
So most of the time, they don't have enough red blood cells in their body system. Now, when it comes to malaria, most of the time, this parasite, the falciparum, it mostly affects the red blood cells, starting from the liver, where it continues to reproduce, and then into the red blood cell, where it's released, and then that's when we start feeling the signs and symptoms. Now, for a normal hemoglobin or a normal AA patient, you feel the symptoms of malaria, but you don't get sick and down. Unlike the SS patient, they don't really have enough red blood cells in their system. So when the parasites are attacking the few ones they have, they tend to get sick easily. They tend to get hospitalized easily, very fast, because they don't have enough hemoglobins or red blood cells that can help them, and they don't have enough white blood cells that can help them fight the malaria. In a normal hemoglobin, parasite can be in you for like 9-10 days, but in sickle cell patients, it can last terms of malaria. So they easily have malaria because they don't have enough red blood cells in them.
Or is it they don't have enough red blood cell, or their red blood cell break down so fast, like it's not always up to the 120 days?
It's not like they don't have enough. One, if you have red blood cells, if you have red blood cells in your body and are breaking down in 10 to 20 days, there's no way your body can make up for it to be, it can't be as much as somebody who is red blood cell is normally taking 120 days before it gets broken down and because you understand. So I feel like most of the time they get attacked because of the reduced red blood cells they have, and then then because their body is they are very, very prone to infection because they don't have enough white blood cells that can help them fight. They're so prone to a lot of infections. So that's why malaria is very, very. And another thing is they have spleen. Their spleen is not producing enough white blood cells to help them fight this infection. So most of the time they get down easily on malaria.
Okay, that's you're correct. You're right. Okay, so what are the signs and symptoms of sickle cell?
Okay, the signs and symptoms are the first one is anemia, and most of the time they start manifesting these signs and symptoms around 5 months of age. So and usually it varies. I've seen a patient that said that she didn't manifest symptoms until she was 15 years. Another one said until she got to the university. So it varies from individual. It depends on your body biological makeup. So the signs and symptoms can be, it varies from anemia to severe pain, swelling of hands and feet, frequent infections, delayed growth, and puberty, ulcer, leg ulcer most of the times.
You didn't mention the dark urine, the yellow eyes.
Okay, talking about delayed growth, when you see a sickle cell anemia patient, know, looking from their physical look, their appearance, you know that okay, there is every possibility that this patient is sickle cell.
But it's not all.
I know it's not all of them. I've actually met a sickle cell patient that is as big as I am.
Yes.
But most of them are usually small in size.
Oh, okay. So when there is a sickle cell patient in a family, sometimes mother find it so difficult to manage, or the whole family, they find it very difficult to manage them. So in your own way now, how will you tell people the management of sickle cell? Aside from the hospital management, that one is for the health workers, but this one is for people around them, their family, their friends, how to teach them or educate them that, okay, this is the way you can manage a sickle cell patient, this is the way you can support them whenever they are having crisis, the way you can go about it. I understand that there's some crisis that is more than somebody's power, that you have to take them to the hospital. So how do you say the management of sickle cell?
Okay, at home, first one is most of the time you educate the mother or whoever it is that is managing the patient, that is taking care of the patient at home. So most of the time the pain is usually, if the pain is mild or moderate, you can educate the mother on rest. You tell the mother that they should allow the child to rest a lot. So then another thing is water. You take adequate water, because most of the time their urine are usually dark. They usually have dark colored urine. So you educate mothers enough water. That I think there's particular measurement, 2 liters per day or so for sickle cell patients, or more per day.
They can take fruit juice, they can substitute it.
Yes, definitely. Yes.
It's tiring just taking water alone. I understand.
It's not easy at all. Even for us, it's not easy. Be taking water.
It's not easy. I got to a point that I even have to time myself, because I need to be taking water. I have to set alarm, take water like every 30 minutes or 45 minutes, because I tend to forget that I've not drank water in a day and I'm just fine. So when I'm thirsty, that's when I drink water, and I don't want it to get to that situation that when I'm thirsty I need to take water. So I need to remind myself. So the same thing applies to them too. All right, you can go on with you.
Yes, most of it. So you tell them to stay away from all triggers in the sense that cold, extreme cold can easily affect them. It can cause the difficult blood cells to block tiny blood vessels. So it can easily cause pain on the hands and feet, pain in the chest, back pain, waist pain. They suffer from pain, especially when they are so cold. Then physical exertion, they shouldn't do anything that is over stress. It's something that is too powerful for them to do. They shouldn't even try it at all. Like lifting of heavy object, they shouldn't even try it. Where I was working, there was this particular guy. He's a very young guy. He knows he's a sickle cell patient, and he went to the gym.
Actually, for them to go to the gym to exercise.
Good.
But they have to know their limits.
Good, very good. This guy went to the gym to lift weight. Swollen hands. His hands were swollen. So they don't, anything that can exert pressure or anything that's heavy, they shouldn't try it. You educate the guardian or the person that is taking care of them. Then excessive heat is not good for them. Smoking and alcoholism is not good for them at all. You educate whoever it is that is taking care of them. Then their medications, you make sure that they take their medications. the pain management, you give them their analgesic, their due analgesic. Then also for patients with peptic ulcer, you tell the mother to avoid giving them foods like beans, food that has acidic content in them, and then they shouldn't take NSAIDs, any non-steroidal anti-inflammatory drug. They shouldn't take it at all. And then symptoms, like they usually have symptoms like fever. When it persists, you give them analgesics to calm it down, expose the patient in, and their food too. They need to eat balanced diet, not just carbohydrate. Balanced diet, morning, afternoon, night, and they need to take a lot of fruit in between meals.
So there's a question I have for you. Mothers, the African mothers, there's this thing that they do for sickle cell patients. Ugu, which is pumpkin leaf.
Yeah.
They squeeze it and then they add milk to it, thinking it's going to give them more blood.
Whoa.
So what do you have to say about that? There's one particular thing I'm actually looking for. So what do you have to say about the ugu, squeezing out ugu and then adding milk to it to give to the sickle cell patient? Is it good?
Squeezing of ugu, me, according to research I've made so far, it's really not ideal.
Okay.
It's
Why?
not ideal.
Why?
Squeezing of ugu.
Why? Well, I made my findings, research, and I found out that ugu contains a lot of iron, which is actually not good for
for sickle cell, because the anemia is not due to iron deficiency. They have enough iron in their body.
They have enough iron in them. Yeah. So, and mothers, they just take the ugu, drink the ugu and milk. It will give you more blood. Let me just end that way. All right. So, what are the complications of sickle cell anemia?
The complications of sickle cell anemia, they are acute chest syndrome. Okay. They can easily have pulmonary hypertension. They can have organ damage, blindness, leg ulcers, gallstone. These gallstones usually occur because when red blood cells break down, they produce it. The end product is usually bilirubin. So a high level of bilirubin in the body can lead to gallstone.
All right, thank you so much for the complication. I need to encourage the warriors, something to encourage them that they are not alone. We are both in this together.
Okay, to the wonderful warriors out there, I want you guys to know that it's not a mistake that you're born, and then it doesn't mean that we don't love you. It doesn't mean that you cannot survive it. We are all praying for you. We love you, and God will continue to strengthen you guys.
Amen. Okay, we love you. Okay, thank you so much for joining me. Such a pleasure to have you on the show. Thank you.